Hello, I'm Dr. David Greene, CEO of the TEX-PAIN Network. Today's topic is, what are the available knee injections for arthritis? Over 40 million Americans suffer from arthritis, and it's the leading cause of disability in the United States. More women than men suffer from arthritis by 20%. Total costs for arthritis treatment exceed $100 billion a year. Between 2000 and 2010, the number of knee replacements in America doubled. And I can tell you right now, the population of the U.S. did not double in that time frame. About 600,000 knee replacements are performed every year. By 2030, that demand could reach 3.5 million a year. Over a third of those with a knee replacement are between 50 and 70, so they're pretty young. A knee replacement surgery is elective and should only be performed after considerable conservative treatment, such as anti-inflammatories, Tylenol, prescription pain medications, topical pain creams, physical therapy, bracing, and injections. There are various types of injections we'll go through, such as cortisone, hyaluronic acid, and then the regenerative medicine injections. All right, first of all, cortisone. Since the 1950s, steroid injections have been a mainstay of knee arthritis treatment. Initially, they were performed for rheumatoid arthritis, and then a few decades later, it spanned over into good old-fashioned degenerative joint disease known as osteoarthritis. They don't cure anything. It is questionable if they harm cartilage. There were some initial studies showing that they did harm the cartilage in small animals. This actually was not proven in larger animals, and it's never been shown in humans. So studies show that 75% of people receive good to excellent results with cortisone injections, and the pain relief may last for months at a time. They are truly the gold standard for knee arthritis. For hyaluronic acid injections, hyaluronic acid is truly the motor oil that was normally found in synovial fluid of joints. In 1997, the FDA approved the first HA preparation, and it's made from rooster combs called viscosupplementation. And there's numerous trade names that are now available: Synvisc, Hyalgan, Orthovisc. None of these have actually shown superiority to the other. One of the largest U.S. studies in the U.S. showed beneficial effects with HA treatment in 80% of patients for over 6 months. So it can be extremely beneficial. And the theory is that it provides lubrication, anti-inflammation, and maybe it compels more cartilage formation. We're not sure. PRP therapy falls under the realm of regenerative medicine treatment, which is designed to repair, regenerate tissue that has been damaged, such as cartilage and arthritis. Platelet-rich plasma therapy involves a simple blood draw, just like you're at a lab, and then it takes that blood and puts it into a centrifuge and spins it rapidly for about 10-15 minutes. It concentrates the platelets and the growth factors. Then a patient will get 1 to 3 injections into the painful knee. There are several studies showing significant pain relief. One showed 70% good to excellent results at 6 months. Another showed, actually the same study showed preservation of cartilage in over 70% at 1 year. They did serial high-resolution MRIs. So it has been very beneficial. Stem cell injections have the potential to alter the course of arthritis. They are either from 3 sources so far: bone marrow derived, fat derived, or amniotic derived is the latest. These are mesenchymal stem cells. They're not embryonic. There's no fetal tissue involved, which removes any of the ethical concerns from decades ago. They have been shown to be extremely beneficial for reforming cartilage, but these are small studies. There are no large-scale studies to date, but it is increasing exponentially in popularity. There's one study looking at knee cartilage defects. 6 months after transplantation, the patient's clinical symptoms had improved, and the improvements have been maintained over the follow-up periods, which have been fairly lengthy, over 2 years. There are various types of knee injections available. All are low risk and outpatient. In combination with other treatments mentioned, bracing, cane, things like that, they may help avoid or delay the need for joint replacement. All can be repeated every 3 to 6 months as necessary. The TEX-PAIN Network provides the top pain management clinics in Dallas-Fort Worth Metroplex area. Multiple clinics throughout the area, accepting over 50 insurances and providing over 25 treatment options with the board-certified award-winning doctors. Visit us online today at painmanagementdallas.com and then call us for more information and scheduling at 844-TEX-PAIN. I'm Dr. David Greene with the TEX-PAIN Network. Your pain stops here.